Thank you. So basically, today we are going to start a new topic, which is very, very important and very, very much interested and very, very much give results to you. So when you master in temperament, then you can easily diagnose the disease in electrohomeopathy, and you can easily give treatment to the patients, and you will get 100% result if you diagnose the temperament of the patient in electrohomeopathy. So basically, the temperament or constitution, some electrohomeopath tells you about that the constitution is different, the temperament is different. Some doctors tell the temperament is and constitution both are same. So basically, in my opinion, whatever name you give, that which will define that the nature of the patient. So at last, if you give the different names, but you are selecting the same thing, okay? So it's upon you which name you can select. So I will use both of them, constitution and temperament. So let's talk about temperament or constitution. So basically, this is a very old concept, not new in no, and not only new in electrohomeopathy, but also it is used in past philosophers, past physicians, past historical uh, doctors. Okay, so basically, they utilize this theory, but not completely whole note. Okay, they will utilize and they will use this theory. But after 19th century, after Dr. Count Systematic, he gave complete picture about temperament, and as well as it's important in electrohomeopathy. So basically, uh, every plant have temperament, constitution. So according to his nature, his behavior is dependent. So, so basically, so if the human temperament and nature plant temperament is balancing, we balance the human temperament with the help of these medicines with plant temperament. So the medicine will give 100% result. So basically, what is temperament? I already discussed that the behavior, the nature, and the whatever goods, whatever bads, whatever prawns, whatever pros and cons. Okay, everything what is had individual yes individuality is there. So there's the reason one person is different from another person. One person interested things cannot be matched to the another person. One person uh, taste is different from other person. So basic, but some groups of people have some like of this same quality of nature. Okay, like I'm a mixed temperament. Okay, I'm sanguine dominance temperament person. Okay, I have lymphatic temperament also, but it is mild. But sanguine is more dominance in me. So what happened? Whatever in 100%, there is chance of 80% matching persons are there in my around. Okay, we match both, can match in dressing sense, we are matching in walking style, we are matching in talking style, we are matching in eating habits, but 20% is different. Okay, there are other person who are purely sanguine temperament patient. They are the other person, they are purely lymphatic temperamental patient. Okay, they are their temperament, their nature. Okay, their nature may be same, but there is only difference in 10 to 20%. Okay, so basically the nature which is present in our body, which decides to what to select, what to not select, how to uh, behave, how to eat, how to walk, okay, how to uh, receive the information, and how to send that receiver's information to other person. So it's depend upon the nature. So basically nature is developed by two to three things: what he eats from the beginning of his child birth, what where he lives. Okay, this is also helping to develop the temperament. Okay, with whom he is living, what type of uh, environment, what type of community, what type of persons with whom he is living. So this is very important. Third thing is very, very important. So this also amplify on that person. Okay, on that person. So basically, we need three things. We need what we need? We need three things. The nature which is had the person to glorify that temperament. Okay, first is where he is living. Okay, second is what type of food he is eating, with whom he is spending his time. And another fourth one is education. Education also give the person's nature to improve his nature. Okay, so this is the four things. And basically, some things will not change from the birth to the death. Some things will change after birth and remain same, and it will change at the time of death. Okay, some things will start at the beginning, change in the young age, and again they will revert to the end of the death. So basically, this is also a nature. Okay, likewise, we have number of person in the childhood. They will do lot of things. Okay, there are a lot of things they will not study. They will always spending time in the playing. Okay, and at young age, their nature suddenly changes. Their eating habits changes. Their person, their friends will change. Okay, so everything is changing in their life. Some person, they are very intelligent in studies. Some persons are very interested in studies. But later age, gradually, when he reached to the young age, suddenly he stopped everything. He have all the bad habits. He never want to study. Okay, so this is purely depend upon the nature, what he had. Okay, he is changing day by day. So basically, likewise, our body organs have temperament. Like our soul have nature. Okay, like our body have nature temperament. As we were deciding that in electrohomeopathy, the organs also having temperament. So basically, we have in electrohomeopathy, so organs have also temperament. So basically, in electrohomeopathy, there are three type of temperament which is discovered by our Dr. Francis Hermeti after analyzing every patient, every person. So that is sanguine temperament and lymphatic temperament. So let's see about that. Sanguine temperament and lymphatic and mixed. So in the homeopathy, we have also constitution that is syphilic, psychotic, and soric. Sora, syphilic, psychotic. Okay, in Ayurveda also we have Kapha, Pitta, Vaya. Vata, Pitta, Kapha. In Unani also we had Damavi, Balgami, Sakharavi, and Saudavi. These are the Mizaj. They are in Ayurveda we have that uh, constitution. Okay, and in homeopathy we have also, and in electrohomeopathy you have sanguine, lymphatic and mixed temperament. So, so basically, later on, other temperament also developed by the other electro-homeopathy doctors. Those are we will discuss. Okay. Basically, sanguine, lymphatic. These are the base and mixed. These are the base of temperament. So I told you that as we have nature, our organs also have nature, temperament. Okay. If their temperament change, so what will happen? The disease occurs. Okay. So basically what we have to do, we have to give the medications which have same temperament to repeat the same temperament. Then the temperamental remedy will go to the body and repeat those things. First thing is that. Second is saying that, so what type of organs are sanguine temperament? What type of organs are lymphatic temperament? And what type of organs are mixed temperament? First thing we have to know about this. Okay. So when we enter into each temperamental detailed study, we will talk about that. So basically, today we will talk about lymphatic temperament. So let's see about lymphatic temperament. So basically, in the lymphatic temperament, the person's whatever lymph means here liquid. I already told you that in the principles of electrohomeopathy, that whatever fluid is coming, that is lymph. It may be salivary glands, okay, it may be pancreas which are releasing insulin, it may be digestive enzymes, it may be hormones which are releasing from the endocrine glands. So all will come under lymphatic temperament, lymphatic vessels, lymphatic uh, circulation. Okay, so what will happen? The person who is having lymphatic temperament, his body will vitate of lymph will happen. Vitation of lymph will happen, then his body will have disease. So whatever disease will come, the divitation of lymph will happen. So what will happen? What we have to do? We have to remove the vitation of lymph. Then the person will settle down easily. Okay. So what are the organs? First, we have to know the organs which are preparing lymph, the organs which are utilizing lymph, the organs which are uh, refining lymph. Okay. Both we will discuss. So what are the organs are using lymph, making lymph, utilizing lymph, and filtration lymph? Okay. We have to know all these three organs. Then only you can understand the person, and we have the hints also what type of activity he will do. Then only he belongs to lymphatic temperament. Okay, what type of organs will have disease in future or in present in coming future, then only will able to know. So let's talk about those organs. So we have thyroid, very important. Thyroid organ is very important. This sequence is very important. Kindly remember that when we are using pulse diagnosis, we will learn pulse diagnosis in coming classes. Okay, so you will get to know about those things. So first is thyroid, because this thing is you have to remember according to this uh, sequence. Okay, very, very important. So we have that thyroid gland. What we have? We have thyroid gland, we have pituitary gland, okay, we have thymus gland, we have pancreas, we have spleen, we have renal, we have lymph, liver. So everyone is making lymph. How we know that thyroid is, what is thyroid? Not sorry. So I will explain the sequence in coming classes. Not this sequence is not there. That is helpful. So we'll know about those sequence in coming classes. So thyroid is making thyroid hormones. Pituitary gland is master gland. Thymus also very important. Pancreas for insulin, spleen for blood and as well as lymph because it produces antibodies. Renal is also very important for filtration and reabsorption of all the materials what we studied in kidney chapter. Okay. Liver also make enzymes bile. Okay, very important. And which organs utilize lymph? Central nervous system, because central nervous system have CNS fluid all the time. Digestive system, we need for digestion. Circulatory system also utilizing. Okay, musculoskeletal system also utilizing. Skeletal system because the whatever hormones are releasing from the endocrine glands are coming to the circulatory system. Then only it will go to the other parts. And musculoskeletal system it is also utilizing, and these other things. Okay, and other organs also there in the lymph, that is we have reproductive system organs like ovaries, testicles, they are also releasing lymph. Okay, okay, then only the reproduction will happen, na? Okay, so this is very important. So who refine or who purify the lymph? One is saliva, salivary gland, lacrimal gland. Okay, and we have kidney and other organs also is there. Kidney, urinary bladder, both are also uh, uh, refining the organs, refining the lymph, and sweat glands. Also, sweat glands also refining the lymphs. So basically, these are the things we need to know. So these are the organs, very, very important. Okay. Next is what can we observe the person who is belongs to lymphatic person. Lymphatic temperament. His color is pale, pale face because lymph circulation is activated. So blood circulation is not that much activated. So there is the reason blood will not reach to the higher level of the body parts or higher level of the skin. So there's the reason the color will be pale. Hair is not abundant. Person are liable to shiver and feet cold, especially in the extremities. The person's hands, extremities are cold because circulation is not happening. Okay. It is externally. So externally, whenever a patient come to a clinic, observe his face, observe his hair. First look, then you touch his hands. Then you can tell about all these things. Okay, his appetite is low. His digestion is very slow. He will sleep always. He need heavy sleep. And this is internally. Internally, because the circulation is low, lymphatic circulation is heavy. So there's the reason these things will happen. Extra hints, what we want to know. This is very, very important. This is taken from Rabison. Okay. From the Dr. Sanjeev Sharma. He gave these hints. Okay. We will discuss one by one because I will make practical also. Okay. I will make practical also. Okay. So basically, I think so. So let's talk about extra hints, whatever we have. So basically, when walking style, first is walking style, walk, then whatever food you eat, face, okay. Second, you have to observe face. Third is eat, eating habit. So this three is very, very important. Okay, and is emotions. What type of emotions he had. So this will give the hints to you to closer the lymphatic person. So how he walk. So we have we can see the foot of the person when he is walking. Okay, when he is walking, we can see the foot of the person. Okay, we have, this is the, you think this is the foot, or this is the foot. Okay, we have front and heel part and palm part. Okay, or else this is the foot, or else this is the heel. You can divide two things. So whenever he will walks, what he first he will put the heel, then he will put the foot. He walks to absorb the food, how he is walking. So first what he can, this is the, thing, the leg, the foot. So first he will put the heel, then he will put the foot. Okay, this is the first absorption, first absorb you have to do. Okay, second thing is that, and you can observe his shoes also. Some doctors, what they do, they will observe, they will bring the shoes, they will see that their shoes, and they will tell everything of the patient. Okay, you can try this much also, but not for some person, till you will get the experience. So lymphatic person, first they will put their foot, and after that they will put the head. So what will happen? Because they first they put the foot, their foot region, the heel region will get more rub. Okay, so what will happen? They easily get rubs. Okay, so then you can easily observe that the foot region is most used. So this person belongs to lymphatic temperament. Okay, first hint is this. Second hint is that you have to observe the face. You have to observe the face of the person. First, first we saw the walking style. Now we are seeing the face. First his nose. First his nose. Nose is bridged. Okay. Nose is bridged. Like something is there and you are going down. Okay. Something is bridge type. And tip of the nose. This is the tip. Okay. This is the tip of the nose. Means this is the nose. If this is, if this is deflected, so this is bridge type. If you think that this is the bridge, okay, this is the bridge and this is the deflected nose. So means he is belongs to lymphatic temperament, and his hair is black, mostly black. Okay, or we can tell that black to brown, black to brown. If you mix black and brown color, what you can see, this is mostly black to brown, black to brown color hair, and the nose is non-bridged and this is deflected. And face, first our face, we can see that face, eyes, you have to see the eyes and the cheeks, they are leveled, they are leveled. And what color of the eyes? Eyes are is bluish color, black to bluish, you can see black to bluish color. So you have to observe all these things. So let's see one more time. First is face. First is you saw the walking style. Okay, next you are observing the face. Okay, face is first nose. Nose is bridged. Okay, bridge. Slope. No, no direct nose is there. There is a slope. Then the nose is deflected. Not is sharp nose. There is deflected nose. First thing is, and that when he smile, the eyes, you have to see the level of eyes and face. If the face or eyes are not matched, not in level, more cheeks are not coming out, you can think that this person belongs to lymphatic temperament. First. Second. Third is you have to observe his hair. hair are in black to brownish color. Black to brownish color. This is very important. And second is eyes black to bluish color. Bluish color eyes are there. Okay, so this is very, very important phase. Now, what type of food he eat? This is also very important. He eat mostly non-spicy food, mostly non-spicy fish, and he's mostly vegetarian. And if he is non-vegetarian, he eat non-veg not daily. He want to eat once a week, twice a week, according to his nature. Okay, so these are the things you have to ask the patient, or you can tell the patient you are non-veg, okay, and doesn't like to eat spicy food, okay, and you can tell all this thing to the patient. Next is how emotions also very, very important. Emotions also very, very important. Let's see the emotions. He will not mingle easily. He will not mix with other. He's introvert, okay, and he will not talk much, okay. He will not get angry much, but he will get uh if he get more angry, what will happen? He will get angry. It will his angry is for longer duration, longer time. So this is his emotion. So how he is walking, how his face looks like, okay, and what type of food he eat and what type of emotions he had. So this thing will matter, and you will get the point to treat the patient. You can know the temperament, and you can easily treat the patient. Okay. Now come to the what type of diseases he will get. Most of the anemia, glandular problem, rheumatism, blind piles, fistula, okay, menses problem, okay. In male, you have impotency, okay, skin problems, okay. This is also seen. So what type of remedy you can choose? We have two remedies. One is S and L. S1 or S2 or L1, so that they can select these three remedies. The person who is sanguine temperament, who is lymphatic temperament, you can give S1, and whose temperament is lymphatic, you add L1 also. So this is the thing you have to remember during the treatment of the patient of lymphatic temperament. Okay. So I hope you understood. Okay. Tomorrow we will discuss about sanguine temperament.